Here I would like to summarize a few points why we are having this intensified information education and communication campaign. We are starting from today and it will continue till 12 October 2026. So here are some of the points I would like to share with all of you. The main focus of having this campaign is, the first one is to increase awareness about HIV, AIDS and STI. Now, who has launched this campaign to improve awareness on this issue? Of course, we are having awareness programs several times, but again, we need to enhance this awareness program on this very pertinent issue in our state. The second point is to promote a preventive behavior. Another focus of this campaign is to encourage people to adopt safer practices and take timely preventive measures, thereby reducing the risks of HIV and STI transmission. Another point is to reduce stigma and discrimination. We used to say that we don't have any more stigma or discrimination, but in our society, we have still this stigma and discrimination in regard to AIDS and HIV and STI. Because stigma often prevents people from seeking testing and treatment. Thus, IEC activities will promote empathy, dignity, and acceptance of people living with HIV.
As awareness campaign can inform people about HIVs, about STIs, but our responsibility does not end there. When someone decides to seek information, testing, or care, our health system must be ready to respond. Our health needs do not exist in separate program compartments. A young person may need HIV and STI information alongside with other health services and reproductive health services. A pregnant woman may require screening for HIV, syphilis, and hepatitis B as part of a routine checkup. We therefore need to strengthen convergence across our different health programs and make better use of our existing health facilities and platforms to provide a basket of essential services. This is particularly important as we work towards the goal of the triple elimination of vertical transmission of HIV, syphilis, and hepatitis B. Every person who walks into our health center is an opportunity for us to screen, to counsel, to treat, or refer. To the frontline health workers, I would just want to say and emphasize that is our nurses, our counselors, our outreach workers, our peer educators, our link workers, and other health professionals. You are the bridge between the communities and the health system. You not only carry the message into the community, but you're also helping people to navigate through testing, referral, treatment, and follow-up. We must therefore ensure that our teams work together and that our facilities are prepared to respond to the demand generated through this campaign. Ultimately, the success of this campaign will not be measured on how many people receive a message. It will be measured by whether the message leads to a healthier choice, timely testing, appropriate treatment, and continued care.
As we look at the public health landscape, we are reminded that HIV and STI continue to pose a significant challenges across the country and within our states. While medical advancements have transformed HIV from fatal diagnosis into a manageable chronic conditions through accessible testing and antiretroviral therapy, the social barriers remain stubbornly intact till now in our society. Stigma and discriminations are often more lethal than the virus itself. Fear of judgment stops people from getting tested, prevent individuals from seeking timely treatment, and forces vulnerable populations into the shadows. This campaign aims to shatter those walls of silence and fear. These aims can be achieved only with the involvement of all stakeholders through enhanced knowledge, promote safe practices, and eradicate stigma. Our youth are not just the leaders of tomorrow. They are the primary change maker of today. Through platforms like Red Ribbon Clubs, creative arts, digital storytellings, social media campaigns, and grassroots community outreach, we can bring a big change in our society. When youth speak to youth, the message resonates deeper. Myths are dispelled and progressive attitude takes place. Government agencies, civil society organizations, faith-based groups, village councils, media partners, and healthcare workers must lock arms. In this movement, we need active community participations to ensure that testing facilities, counseling centers, and treatment networks are perceived not as a place of fear, but as sanctuaries of healing and support.
With the things that divide us, instead of unite us, like the world we built, the hate and still we feel with judgment inside us.
I want to be
done.
done with the violence and the silence, facing injustice, but I wonder if it trusts us, if loves and goodness. Soon we will be done with the troubles of the world, troubles of the world, troubles of the world. Soon we will be done with the troubles of the world, when heaven comes to earth. Soon we will be done with the troubles of the world, troubles of the world, troubles of the world. Oh, soon we will be done with the troubles of the world. Heaven comes to earth. Soon we will be done with the troubles of the world, troubles of the world, troubles of the world. Soon we will be done with the
Communication, campaign on HIV and sexually transmitted diseases like syphilis, hepatitis, and many others. And I cannot think of a more fitting occasion to launch this than today, as we observe International Youth Day. Today is about so much more than just launching a campaign. It is a moment for us to pause, look around, and reaffirm our collective commitment to safeguard the health, the dignity, and the ultimate future of the people of Nagaland. International Youth Day is a powerful reminder that our young people are not just the leaders of some distant tomorrow. You are partners in shaping the present. Your energy, your innovations, and your absolute resilience are among our state's greatest strength. The choice our youth make today will help map out the future of our entire society. That is why investing in your health, your knowledge, and your empowerment isn't just a social responsibility. It is the very foundation upon which the future of Nagaland will be built. As we observe this day, we must also be entirely honest with each other about the mountains we still have to climb. Friends, Nagaland continues to face a deeply significant HIV challenge. Right now, our adult HIV prevalence stands at 1.37%. It is a sobering reality that our state records the second highest adult prevalence in the country, second only to Mizoram. If we look closer at our district, Dimapur records the highest positivity rate at 3.29%, followed by Noklak at 3.07% and Chümoukedima at 2.01%. At present, Nagaland currently has estimated of 23,470 people living with HIV. Yet, even in the face of these heavy numbers, I am filled with hope. Our collective, relentless efforts are working. Since 2010, Nagaland has achieved an incredible 39.97% reduction in new HIV infections and a staggering of 80.21% decline in AIDS-related deaths. What does this tell us? It proves without a doubt that prevention works. It proves that early diagnosis saves life and that consistent, uninterrupted treatment yields results. Dear friends, when we look at the narco HIV estimation of 2025, we see that districts like Paiwang, Konyak, Dimapur, and Longling fall into a moderate prevalence category, while Mon district records the lowest at 0.29%. But this variation shows us that HIV does not look the same across our state. Every district faces a unique reality, and because of that, every district requires locally contextualized solutions. And I want to make this moment to thank sincerely the Government of India and the National AIDS Control Society organization, NACO, for their visionary leadership. Initiatives like the Mobilization for AIDS Suraksha give us powerful framework. It allows us, our districts, to truly make ownership of their health outcomes through evidence-based planning and community-centered interventions. Our guiding principles are clear: district-led, data-driven, result-oriented. Speaking of practical, ground-level solutions, I am absolutely thrilled today to flag off 5 new health on bike outreach motorbikes. These bikes are headed to Newland, Seminu, Goensang, Longchim, and Mokokchung and Tobu in Mohon district. These vehicles are so much more than just steel and engine. They represent health care in motion. They are taking essential services straight to the people, especially those living in our most remote and difficult terrains. We refuse to let distance be a barrier to health care. The first 2 rounds of this campaign showed us exactly what happens when we unite for a common cause. Together, we conducted more than 1,300 village meetings. We reached out over 1,000 schools and 200 colleges. We carried out more than 7,600 door-to-door awareness drives and directly engaged over 2 lakh citizens across Nagaland. Those numbers are beautiful and they deserve a round of applause. However, activities alone do not define success. The true test of this third round will not be measured by the number of programs we organize. It will be measured by how many lives we protect. It will be judged by how many people feel safe enough to come forward and get tested. How many individuals receive timely treatment and how effectively we tear down the walls of stigma within our communities. We must intensify our focus on triple elimination of mother-to-child transmission, HIV, syphilis, and hepatitis B. Every single pregnant woman must have access to testing and timely intervention. We owe it to our children to ensure that no child begins life with a preventable infection. At the exact same time, our healthcare system must ensure that its services are accessible, completely confidential, professional, and entirely free from discrimination. Everything we do must bring us closer to the National AIDS Control Program goals of the global 95, 95, 99 targets. We must ensure that 95% of people living with HIV knows their status, 95% of those diagnosed receive sustained treatment, and 99% of those on treatment achieve viral suppression. To make this happen, I'm appealing to every single person in this room and across our state to become an active partner. To our young people, I challenge you to seek out facts. Doctors always tell us that health is a personal subject. But I think most of the doctors from the state knows about my health because I consider health as an open chapter, open book. Every 3 months, I do regularly master checkup for LFT, KFT, and other viral diseases. So I request the honorable members, I request the delegates, the students, to know the facts about our health, our body. Know also your risks, know your status, and make informed, healthy choices. Use your school, your colleges, your youth organizations, and social media platforms to spread truth instead of misinformation, compassion instead of judgment, and hope instead of fear. To every brave individual living with HIV, today I encourage you to stick with your treatment and live the healthy, fulfilling life you deserve. Your courage is a beacon. It can inspire the younger generation to make informed choices and break the chain of stigma. Please remember this, above all else, you are not alone. We stand with you together. We will build a society grounded in dignity and in love. And to our district administrations, healthcare workers, community leaders, churches, schools, civil society organizations, partner NGOs, and representatives from the IDU and HIV positive communities, your partnership is irreplaceable. I urge you to truly own this campaign. Look at your local data, find the gaps, reach the unreached. Innovate from your specific community needs, and let us measure our success by the lives that we change, not just the boxes we check. The government of Nagaland remains completely steadfast in its commitment to strengthen HIV prevention, treatment, and health care. But the government cannot heal the society alone. Success demands the united hearts of every institution and every citizen. As we launch this third round today, let us renew our sheer goal to build a healthier, more inclusive Nagaland. Let us build a state where young people can access accurate information without shame, where testing is embraced without fear, where every person living with HIV is treated with the utmost dignity, and where every expecting mother receives timely quality care. Let us build a Nagaland where stigma has completely no place in our homes, our schools, our churches, and our communities. On this International Youth Day, let us do more than just celebrate our youth. Let us work alongside them. Once again, I express my heartiest appreciation to the Government of India, NACO and SEX, our district administration, healthcare workers, partner organizations, and every single volunteer. Your dedication is the backbone of this response. The coming week gives us a golden opportunity to move from awareness to action, from mobilization to measurable impact, and from stigma to solidarity. Together, let us build a healthier, safer, and HIV-free Nagaland, where every single individual lives with hope, dignity, and equal opportunity. And responsible choices for my health. To know my HIV and STI. Let us spread awareness. As we work towards an HIV-free future for Nagaland.